Good morning. Welcome to NeoConnect 2020. NeoConnect is NeoCon's online series of resources, programming, and events held throughout the month of June. I'm Monica DiBartolo, NeoCon's Program Director, and I want to thank you for joining us. Today's session is approved for 1 IDCEC credit for interior designers, 1 EDAC credit for healthcare designers, and 1 LU credit for architects. Please refer to the screen for more details. We end this series of NeoConnect webinars with an important and timely program entitled The Design of Community Senior Living Trends. This session will address the challenges faced by designers to incorporate the essence of senior living into the overall design of a community. Our expert will discuss the trends and provide the direction for senior living and the related healthcare marketplace from the following perspectives: health and wellness, sustainability, programming, care population, and utilization of inclusive design principles. Our speaker, Jane Rody, is a principal of JSR Associates, Inc. in Catonsville, Maryland. Jane is one of the leading experts in the industry of senior living design. Jane's areas of expertise include person-centered care model development, architecture and design for the aging population in senior living and related healthcare settings, sustainability initiatives supported by performance characteristics, and education to peers, regulators, and care providers. Jane serves on various healthcare and sustainability committees supporting research, advocacy, and humanistic approaches to care. She is the recipient of numerous awards and honors, including the first Changemaker Award for Environments for Aging from the Center for Health Design and the ASID Design for Humanity Award. She has been recognized as an honorary alumni of Clemson University's Architecture and Health Program, and she has been honored as one of the top 10 women in design, demonstrating leadership in healthcare and senior living design. Please welcome Jane Rody.
Thank you, Monica. It's wonderful to be here. I appreciate it. I'm just sharing my screen now for everyone. And we are going to start in just a sec. There we go. Hello, everyone. Thank you, Monica. Thank you, NeoConnect. I am very excited to be here today, and I'm pleased to be your closing speaker for your wonderful events that you've been having the last few weeks. And we have so much to talk about. Our lives have changed so much in so many different ways. This slide is so interesting to me because I had this slide into my deck way before anything happened with COVID-19. And when I start to evaluate it and look at where we are, the senior living world, as you know, and most of you have been tracking both nursing homes and assisted living, we topped 50,000 deaths in the United States. That's 43% of the deaths to date as of June 16th, 2020. So this breaks my heart in many ways, but also gives us opportunity for how we change the future. If change is going to happen, now is time for it to happen and for it to occur. So I want to talk through some ideas and maybe get you to think through some of those ideas and how you may approach how you evaluate senior living, but also how you approach life. Because I think a lot of what we talk about has to do with life when we're talking about the elder population. I also want to say that I've seen so many things about masking up, not masking up, and the whole world of that. I want you to think about it. I heard something this weekend I thought was really good. Think about it as though you would about seatbelts, right? We didn't used to have seatbelts. We didn't used to have child seats. We didn't used to have any of that. And we started doing it, and at first there was, some rub and some friction about it. However, if wearing a mask can help you and help someone else, then consider doing it. So it's kind of a mask up, kind of a seatbelt kind of comparison. So I want to thank you for that, and we'll get going with the program. So the learning objectives of what we're going to go over is we're going to look at some senior living trends that impact design. We also want to look at what older adult needs are in terms of society and how does that reflect it? And what do people really want? I think often we don't ask the elder. Ask the elder. The elder can tell you. We've done presentations and seminars where people are like, I'm going to invite a bunch of staff so they can tell us about the elders. And I'm like, well, you're not going to get very much out of that. So why don't you ask the elders to come? And older adults, although they're older, they have so much to offer. A person who has dementia can make a choice. You can show them 2 plates of food, allow them to make a choice. There's so many different things that you can evaluate and look at when you think about older adults, as well as the wisdom that they carry and the experiences that they've had. I don't know if any of you have seen the woman who lives in Europe who was 105, I believe, and she survived both the Spanish flu as well as COVID-19. That's one tough chick. So let's think about what people have to share and what they can tell us about their world, because that's where we need to be in terms of what needs to happen in the future. Looking at a mindset and requiring creative innovation and allowing for it is something that we're not seeing in the senior living world and the envelope of it. I don't know why that is. I mean, now is the time for this change to occur, and for people to not address it now is just, I almost like, I'm going to say, you know, putting your head in the sand, because it really does need to be addressed, because the system was already broken far before COVID-19. It just highlighted all the issues that we're currently having. And then we want to evaluate the change in senior living design and how that can impact acute care. So this has been something we've been working on for a while in the inclusive environments world, is that most of the residents that we think in long-term care, we think of them as older. They're not always. It could be developmentally disabled. It could be intellectually, cognitively impaired. It could be other reasons why someone's in a long-term care setting. But what most people don't realize is the majority of patients that go to outpatient settings and that go to ambulatory care and go to hospitals are predominantly older. And so if we can look at some of the benefits of universal design and the process of universal design, we can talk about inclusive environments in all settings. And the more we see this in healthcare, the more we're seeing it everywhere. And COVID-19 is making that an equalizer across all types of environments. So as we look at inclusive environments, I want you to think through about how you would focus on what the changes could be for the future. So we used to think of building all inclusive design more as just as a process of accessibility. It was sort of an equalizer between, oh, universal design, it's a physical environment equals accessibility. However, it's also meant to not have to have adaptation for people to be able to use a space. And these were the earlier definitions of what we used to think of and utilize as universal design. But let's take it a step further. Let's look at universal design plus service access and creating all-inclusive community. A lot of times the physical environment is not enough. We have to start operationally. We have to look at it operationally. We have to evaluate the needs, the desires, the wants of an older adult and a person. Think of people as individuals, but allow them service access. And this really goes for anyone. It doesn't have to be an elder that this is part of that process. Service access are things like amenities, healthcare, transportation, all those things and pieces that allow someone to live in an inclusive community and thrive. So if we look at this as a process that it enables and empowers someone, this is a definition that I really like to use, and it comes out of the University of Buffalo. Jordana Maisel has become a colleague of mine that I really appreciate the work that she has done with Dr. Steinfeld. And this really talks about improving human performance and about evaluating health and wellness and having access. So think of it, inclusive design, as more of a process instead of looking at it as something stagnant or something only in the physical environment. So you want to look at both sides of that. Excuse me. There's also an incongruence. And so I think that when we look at ADA, we think that that's accessibility, but ADA was not designed for older adults. It never was. It was designed for returning veterans who had upper body strength, but were paraplegic for the most part. So in order to address and go to the Federal Access Board and have conversations with the Federal Access Board, to have conversations with the IBC folks for building codes and looking at examples of where ANSI 117 that mirrors a lot of what's in the ADA, how that could be changed and adapted. so they asked for research. And at the time, the Mayer Rothschild Foundation supported John Sanford at Georgia Tech to evaluate a process and what is the correct locations for things that would actually work for older adults. And so this had a huge positive impact on the guidelines for design and construction of residential healthcare and support facilities. For those of you who don't work directly in senior living or in healthcare, the FGI, Facility Guidelines Institute guidelines, are the go-to for licensing code in the states. So they have a whole set of design criteria and information that can help positively impact what is happening and how we get to a person-centered care world. And so we have changes in IBC as an exception. A lot of that came out of the John Sanford study. People like John Williams out of the West Coast and Amy Carpenter from SFCS were all part of that. It took a village for sure to make some of these changes, but now we're seeing, based on the body of research, that there's options now that would make things more inclusive to reduce the incongruence with the regulation. So the University of Buffalo has an inclusive design section and department area, and as part of their architectural school. I would definitely take a look at that and start looking and evaluating what that looks like from the operations perspective. So basically, operations and services plus the environment, you want to support independence, quality of life, and choice. And anyone would want that. So if you think about a filter of using yourself as the filter, would I like that? Would I find that acceptable? Will I be okay with that if my loved one was there, or I was there, or I was in an operation or a care model that didn't really work well? So looking at it through that filter all the time, and realizing that working in aging can be an incredibly passionate, wonderful, wonderful career path. And I think that sometimes people don't realize that it really can be a rewarding, wonderful care path. With what we're seeing with COVID-19, it's not surprising in terms of the spread and how it's spread. There's three basic issues. One, we have vulnerable populations congregated together. Two, they're not dedicated staff are not assigned to groups of residents necessarily. Where we have seen that, we have seen a huge reduction in the amount of COVID cases or no COVID cases. And part of that then stems to the staff part, and it's a social issue of paying a living wage. The majority of people who work in long-term care in the US and probably other countries as well, they need to be able to have a wage where they're not working at 2 or 3 facilities. So if you're working at 2 and 3 facilities, it puts them, it puts their families, and it puts the residents at risk. So it's really evaluating the whole system of how we look at it. From a financial perspective, it's the same way. We have the same people who are regulating it are also the people who are financing it when it comes to skilled nursing from CMS. But some changes could happen there that could actually improve that situation a great deal. So an evaluation of that continuum, you want to look at not just the care, but you want to look at the life of a person. Each person is a unique human being. There might be 10% of a reason why they're in a community or in a facility because they have a need, a physical need usually, or an emotional need, or dementia could be an issue. However, the other 90% of that person is the same wonderful person they've been their entire life. So support the 90%. It's not about their diagnosis. It's about them as a unique human being. So what I started looking at was that this idea of baby boomers and what they want has been a conversation probably for longer than we've had baby boomers. It's been a conversation for at least 20, 25 years, and everyone's been trying to guess. Well, no one really knows. However, what we do know is that this idea of multi-generational communities and a lot of the same pieces and parts that people want in the millennial side are the same things that older adults want. Ease of access, being able to see friends and family, easy to get to services, some walkability. Lyft and Uber have actually been a great boon for the senior living world because it doesn't isolate people and allows people to get out for those who can't drive. Access to the amenities, mixed generations. We don't live where we have dinner every night with 160 older people, right? That's not normal life. Normal life is multiple generations, it's seeing children, it's seeing, and you can choose as to what the level of participation is. However, that's more of a normalcy in terms of life and how we look at life. So this idea of flexible space and having scalable space is very important. To only be building for millennials is to be ignoring half the equation. I love that expression. I love that quote because this comes from a developer who has done some really unique things in the Baltimore, Washington area. And we know that if this is the case, then why aren't we designing things with more of a multi-generational and universal design approach? Right? So if we look at some of the commonalities, those include the service access, like we talked about. It includes rental versus purchase, flexible and adaptable, multifamily lifestyle. This idea of using the term age restricted, you know, that really isn't something that came about from being an older adult saying, oh, I want to be age restricted, really? Seriously. So if you really think about it, the terminology really is tied back sort of like this 55 plus community people talk about. Really, that was a zoning mechanism to be able to develop large tracts of land that wouldn't tap into things like educational services and roads and certain traffic patterns and things like that. That was how they used it as 55 plus, was to continue to be able to do development. It really didn't have anything to do with the care and the evaluation of the people that were going to be living there. It was just a mechanism. And so I think we start looking at health and wellness as the focus. It changes the conversation and it changes how we look at things. So change the nomenclature. No more aging in place, right? We're all aging in place. I'm sitting here aging in place right as we speak. It's about wellness, lifestyle, choice. My goodness, everyone likes choice. And I don't know about you guys, but it gets a little crazy when you're during COVID-19 and you don't have access to people, and then you do have access to people and everyone's kind of a little cagey about it all. So it creates a very strange sense of where you are and who you are, and you're working from home and how many more Zoom meetings can you do? But that opportunity to have choice, and we know that it will change again in the future so that we can all be together again, change the nomenclature around this whole aging topic. You know, it's really living to the fullest. It has nothing to do with senior anything. And so if we think of it that way, and we think of it as respect for elders, I think it's a different way of evaluating the filters that you use. One of the students that I had the pleasure of working with at Clemson, Tatiana, I was looking through some things for multi-generational communities, and I found this, and I think she nailed it, right? The social environments, being healthy, accessibility, safe, affordable, adaptable. Those are all the things that came out of her thesis. Tremendously proud of her. She's done a wonderful job at executing and evaluating what multi-generational community could be for the future. So I want you to do this for me. You don't have to close your eyes because I don't want to lose you, but I would like you to go, what if? What if you took an intergenerational approach? So what if we started with the premise that all things that we design are person-centered? What if human interaction was the basis for all the design that we do? If your care model supported workforce development, could you improve that part of consistent staffing, livable wage, education and training that is lacking currently in our market? If multi-generational approaches solve housing crises and socialization needs, could we actually have younger people, older people, youth at risk, older adults, families living together? Could we actually help solve some of the housing crisis and actually evaluate how socialization can occur, both naturally as well as through planned activity? And what if 90%, we have 90% of our communities that are not served, period. The top 5%, top 2%, we have facilities, we have communities for them. The lowest of low income, we have some things, but right now, if it was me, I would not place an elder or family member in any type of nursing home at the moment, unless it was a small house, it had a consistent staff, it had a small number of residents that were together, they got to socialize because they treated the unit as a family instead of each as an individual. There's so many components that I would want to see if I was going to be looking at serving anyone in a more moderate or lower income bracket that needed to use skilled nursing. And what if people could look at aging as a proactive adventure? I mean, we see those pictures, you know, we see the older lady who's, you know, skydiving and doing all those different things. Why can't that be an approach that we all take? So we need to believe person-centered care is a given. It's a right, it's a choice. Choose it, right? What if we believe in something better for our elders? What if we look at reinventing the industry? You have the power. Everyone who's on this call has this power. Everyone who works in this marketplace has the power of change. if they choose to do so. So recognize what's important to you personally, and then what do you believe, and work from that point in terms of how you could reinvent the senior living industry. Some of you may have seen the kids who've done, younger people who've worked through and created ways of doing movie night remotely, and then they come in after the movie and everyone's watched it, and then they do discussions. So this idea of the multi-generational coming in together and working together to be able to promote that, I think, is a really good example. We have to overcome some barriers. Younger people don't understand that there's career paths in the field of aging. Most of the images of what we have as younger people in aging are not positive, right? Most of them are much more evaluating it from the stinky nursing home perspective. There's so much more that can be done there. And I think that once people understand it, I think it has a possibility. We've had a lot of interns. We had one intern student, great young man, 17 years old. He loved it. And so he's going into engineering, and he knows so much about what we do. He stays in touch. He's just this wonderful young man who just needed to learn about it. And I think that that's really important. Organizations that access, learn, and experience new care models. I think this is part of the problem. So if I'm an existing provider, it's working, the money's right, the real estate investment trust is making their 25%, good enough. Well, no, it's not good enough. And so if you can look at the new care models, and organizations want to learn about them, so whether it's the Greenhouse Project, or it's Small House, or it's household design, or it's continuing care retirement communities that include those different kinds of access and new care models, there's no place for people to come and learn. And so from talking to one of my really good colleagues, Steve Lindsay, he's up at Gardens by Village in Lancaster, Pennsylvania, we started talking about this idea of, if we could overcome one of the barriers, what would it be? It would be allowing people to have access to training. And so from that, we also learned that a lot of frontline staff, communities would be happy to send them for training. The problem is the lodging cost. So we realized if we could impact positively the lodging cost, we could potentially bring more people to the forefront to be able to train. And now, as we've all learned during COVID-19, we can all do that more virtually, right? So, and then there's the coordination of wraparound services. And what do I mean by that? So that's a management model. Old terminology used to be care management. And people would be like, oh, care management, that's not a real glamour, right? So you might see it as concierge care, or coordinated care, or just a health and wellness person who's a director or activities. It could be called many different things. It could be life coach, could be another one. I've seen all different kinds of varieties of that. But basically what it means is that there's somebody in the independent living side, no matter who's living there, whether it's boomers, or it's millennials, or it's families, or it's at-risk youth, or it's kids, or it's students, or it's whoever. They have access to someone who can help coordinate service. And it could be any kind of service and amenity it might need. And that type of coordination is what's always been missing in our healthcare system. So when someone discharges from the hospital, they don't have the right coordination of care when they go home. A lot of times that results in readmission. There's all these other things that we can do so much better simply by having somebody who helps coordinate and follow up. So care based upon individual needs. So basically looking at people so they can uniquely get what they need, instead of assuming that everyone who lives in assisted living all wants to play bingo. You put me in a laminated plastic chair and bingo, and I'm going to be one unhappy resident. So why aren't I being able to do things that are individual needs that I would like to do? And so I think that we think that, yes, people need to come together when they want to, but they also need to be able to do the activities that are good for them. And I don't think we often do the profile. So we talk about doing a life care profile versus just a health plan that talks about their care management and their specific services that they're getting, but expanding that into their entire life so that you really have a much better idea about it. And supportive environments do not limit residents, right? So there's nothing like seeing a beautiful garden. You can see the garden, but they lock the doors because for some reason they don't want the residents to be out there. Usually it's because there's not sight lines that allow the staff to feel comfortable that someone's safe, because that is their job, to make sure that people are safe and reducing risk. However, if you design it correctly and you leave that as easy access, it's like having at-will food. It's like having all these other things that are choices during the day that allow people freedom of movement. You'll notice the lady with the sharp knife. Every time a provider sees that, they freak out. But you think about it, that lady's probably cut vegetables her entire life. And I think it's okay. You have to balance the risk with the family, with understanding, and also with what the desired needs are for the resident and what they would like to do. So when we talk about human interaction, this idea of human interaction has to do with evaluating space differently. And I will use an example because one of my volunteer kids, she had her daughter had a baby who was at Hopkins. And I remember walking in and waiting and looking at the waiting room and thinking, here's a sea of chairs that has no understanding of the human interactions that happen in that space. So that could be sad news, happy news. That could be, I need to take a meal. I need to take a nap. I need to go to the bathroom. I need a drink of water. I need all of these different things. Not one of them was accommodated within that waiting space. That's what I'm talking about, human interaction. Do an overlay, look at all the social engagement and activities and understand better where that interaction is taking place and design accordingly. So I want to share with you a concept for a community model. I've been working on this for about 2.5 years. It's called Live Together. It's intergenerational community, and it helps to solve some of those issues of the what ifs of what we talked about. So I think that all ages should live together. I think that's natural. And I think that that's what multi-generational, intergenerational models start to talk about. So why did this community model happen? We were not at a tipping point for person-centered care. My friend Steve and I were talking, we were at a committee meeting together, and I said, why isn't this happening? And so we talked a little bit about that lack of training and education, right? How do we give a hands-on experiential approach? The other problem was not only were there no training centers really centered around this for frontline staff, but there also wasn't a place for research to be done. So we figured we could actually handle that too at the same time. And so I asked him, I said, do you think residents would be overwhelmed to have students in there with them doing research? And he goes, oh my gosh, it would be awesome for them. They would love the interaction. So that's when we started looking at things, and we thought, well, what if a community came together around what we're calling an engagement center that actually puts together all the different pieces and parts of the training program, the research program, the education program, but also the socialization intersection. So purposefully design, intentionally design it so that these programs were set up as part of this. And so this gives organizations and staff an opportunity to see the change in action, right? How many times do you do better if somebody shows you something instead of just tells you? It's a lot better when they show me because I'm more visual anyway, so it helps. And evaluating the example of designing community, but also for me, one of my other passions besides elders is any vulnerable population. But I've been a volunteer mom for almost 30 years for 2 young women. And I look at how much we failed at children aging out of the child welfare and the foster care system. And so if we could help with the workforce development, not only for frontline staff for our own community, frontline staff for other people's communities, but also evaluate and provide an opportunity for some of the kids who are aging out. Because to be honest with you, they get to the aging out part and they don't really have anywhere to go. It's kind of like when you get out of prison, here's your bus ticket, here's your train ticket, see ya. It's not that much different. And it's not for lack of trying. Many people have tried various different programs. It is very difficult. To keep people safe has become the main priority, which I understand, but also is how do we change it for them for the future? Give them the opportunity they need or the support that they need, even if it's a house mom, because sometimes that's what they need. And then if we look beyond a project, the community at large, identifying gaps and things like access to transportation services, amenities. So in this case, the cafe food is top. So my young student that was with us, he did a research project along with some other students, and they came back with us and they said it's all about the cafe piece, it's about meals, it's about recreation activity, and it's about technology. So, and nothing that's really surprising, but those are the three things that bring people and engage people together. So the engagement center has these different pieces and parts. We've added into this the residential assisted living, and we call it residential assisted living versus calling it assisted living only. And that's because there is a model that is residential, comes from the residential side, not from the more institutional side, as assisted living, and can create households of anywhere from 5 to 10 to even up to 30 in Colorado of various types of residential settings. And so this is a different way of accomplishing what we've been trying to do with the small house and the household for many years. And the fact that you can share staff. So I can have a social worker, I can have a nurse, I can have a PT, OT, I can have them all working together and being that shared staff, and for independent living just as much as I can for the residential assisted living. So it's all combined together as one model instead of separating each one. And then independent living, we're looking at, we're calling them traditional apartments, but basically apartments, but then also looking at the common.com model. And I'll show you an example of that. So workforce development, an engagement center, and then we've tried it in 3 different varieties and we're trying it in a 4th way. So basically, if you look at existing grounds of a children's home, there's many children's homes across the nation that this actually could work very well with. Look at towns and urban development that's going under redevelopment. A lot of times they'll have their own population that will have issues. Looking at it from a CCRC perspective, which could also create opportunities as well. And then also looking at it from an assisted living, independent living community. So I'll give you a couple examples of where we've been with that. So the food part, we talked about that, right? The engagement of that. This idea of recreation, sports, participation, eating food, all those pieces are very important. Having children is part of this. You know, look at the delight on that little man's face. You know, he's just so excited, and we want delight. We want people to live with delight. The opportunity to be able to have someone that you trust that you can go to and ask questions of. That within that engagement center, if you can ask the questions of things that you know, or Medicare that you can't figure out, or any kind of service that you need, but you know that there's someone there. And we find that a 3-legged stool works really well. So if it's social work, nursing, and OT is really where we think that comes together as a grouping of staff that can use by all residents that live there. So what are the benefits? Purposeful living, providing the care and services that people need, but mentoring and learning opportunities for everybody. And I think that this is where multi-generational really shines. Creating supportive relationships and opportunities to share those experiences, looking at career development instead of just going, it's a job, right? Trying to help people look at that. Workforce development that could help bring up the quality and the competencies and what someone learns. So there's a program out of Grand Rapids where the nursing program, they were able to get the local hospitals who all needed staff. They agreed with X number of competencies that they would pay the staff $2 an hour more, and they would hire every graduate that the woman came through her program. They had lab spaces established. They had all these other things, but they did it collaboratively. This is how we make change. It's collaborative. It is not as a single unit. It has to come together collaboratively. Removing isolation and connecting the generations, I think, is super important. There's a volunteer contingent in the Generations of Hope models that I've worked on. We always have a percentage of time that's required that people have to volunteer. That can be evaluated and staged and updated as it needs, depending on what the needs of your community are. So in my mind, if we could impact 3 to 5 kids, I know it doesn't sound like many, but when you see all of them go through the cracks, 3 to 5 children and they're aging out of foster care or aging out of the system, would be amazing, because I think that we could continue to build that, right? You could build that as a replicable model. And it doesn't have to be just in care, right? It can be dining services, it could be activities, environmental service, it could be facilities, it can be building, development, design, any of those things in pieces. So I want to share this with you because this is, no one would ever let you ride or make one of those carts ever if you look at the risk. This is the children's home where I volunteered for many years, and that's the girls' cottage that's right behind the swing set there that no one would ever let us do. These are my girls, and yep, that's me many years ago, and they grew up in this same cottage. So directly behind me is Taisha, and that's her daughter, Lachey. And the latest we have is Noelle, who is now a little over 1.5 years old. But we look at chronic issues for kids aging out, right? Perpetual homelessness, which is true, and I've witnessed it and seen it. Prioritization of life, maintaining employment, having a living wage, which really is a big part of it. Continuing education, being able to have continuing education opportunities. Taisha is now 44. She's getting ready to start a American Sign Language class. She's extremely excited. She already knows sign, and she really believes and understands how she can leverage that into a career. She also has her med tech certificate that she had a number of years ago, and it had lapsed. And so there's ways to do that while she does the American Sign Language. She'll also be able to work on that certificate. And she's kept herself working throughout COVID-19. Those are huge, huge accomplishments for my girl. She's being consistently responsible. This self-sabotage and low self-esteem, working through that, working around it, helping. They're all things that happen for kids aging out of foster care. So we've worked hard on this model. First, we looked at smaller numbers of independent, larger numbers of assisted living. We've always looked at it as being something that would be a household type of design, and then community factors. So this was actually on the grounds of the children's home where they grew up. We're looking at things that the organization, it's called Live Together, and so looking at that from an organizational perspective. So we really think it's going to be a nonprofit component, which Live Together will be, and it's in review right now. And then looking at for-profit development companies to come together, or it could be nonprofit development companies too, for that matter, to make it work. So we've looked at households and we've evaluated them. We've gotten much smaller in our footprint. We're trying to make it affordable. We're trying to look at all the different pieces and parts in terms of the demonstration project we're currently working on. So this was one model that actually took more of a contemporary look at the household and what it could feel like. Then we were working with one operator and they're like, you know, we would do better if it was more concisely put together. And we're like, okay, so we looked at that. But what we really realized after all of it is that we need to create the operational model and the community model. I talked to a good friend, Crystal Spooner from Orange Tree Village, and she goes, you just need to go home and do this. So it's like, okay. So operationally, we're really looking at operating them ourselves and then looking at development partners to make it work. So that's the goal. So EC is the engagement center. That was the center core of that. The purple is the independent living. The AL became larger households. And for us, the numbers did not pencil. So in looking at it, that's why we've redeveloped how we want to look at how we approach this. This was interesting to me because as an existing urban model, it's the Meridian, Mississippi. Interesting thing about Meridian is that it has a at-risk youth population because they overbuilt low-income housing in the 1970s. So as a result of the building of the housing, it created all kinds of issues in terms of economic issues. So they have a university available there. There's 2 to 3 hospital healthcare systems that are there. There's potential land there. We had looked at a mall site that was actually one site that had been partially available through one of the older community members. I found out later that he was 80, totally got it. He's like, this is what we need to be doing. Why aren't we doing this everywhere? And so when we looked through that, we looked through the median household income, right? So we're doing a little bit of demographic work on it. And then we realized something really beautiful. If you look at the women from 18 to 55 is the largest population there, perfect for working in healthcare if they had the opportunity. And it could be in any variety of different kinds of disciplines within that system of senior living. So this was something really interesting to me, is that you don't have to have at-risk youth that are in a children's home or aging out of the system. You can have at-risk youth or just people needing training or not having access to services and amenities right in the community. So when you're looking at redevelopment, this gives people an opportunity. So mixed income housing, right? Seniors plus 20% families will still fall into the category 55 plus, which is really just a zoning application that helps us do things and build things. Student housing, in this case, the affordability really needed to have skilled nursing instead of assisted living. Assisted living is predominantly all private pay. So when you're looking at that, that's a part of the conversation. But when you look at skilled nursing facilities in Meridian, for example, they have what's called a certificate of need moratorium. I was like, huh. So I went through that. They have 1,000+ bed need in the county, but you have to get a legislative move to get 60 beds released in per release. So that doesn't mean it's impossible to do. It's just that you have to know how to go about it and how to create it so that you could still do a long-term care component versus assisted living. You could always do a long-term care component that's also skilled, if you have the right process to go through and you have the support to be able to do it. And because that is Medicaid reimbursed. So teaching research model with engagement center made sense. The higher education, they had 2 community colleges in Mississippi State, and they had health systems that were there too that also need workforce development. So it's kind of like a win-win-win, but it's all the components coming together to work together. So you got to understand the gaps, and each community can be slightly different, but the gaps, if you can identify them and start to fill them, you can start to create change. We've also looked at doing the Live Together community model on an existing independent living, assisted living, memory care. One of the best strategic meetings we've ever had. It provided opportunity to be able to do engagement and reinforce that engagement comes from outside in, not just inside to inside or inside out. It's got to work both ways. Looking at expanding memory care into a model that does support the household. I realize that there's a lot of hesitation in that side, and so we've been working very hard at trying to figure out how to help people do that better, and doing staffing suggestions for that household model that allow them to go, oh, if I move this group and retrain a little over here, we can actually come up with a community model. It doesn't have to cost anymore. That's always been a misconception, I believe, on part of most folks. So when you look at the model as a summary, you know, who are you serving? So identifying who you're serving and how you're serving. Balance of program activity and natural development, because that relationship of an intentional community, it's a big balance of natural relationships being formed and people on the outside being able to be part of that, and then structured programming. It's a combination of both, and you want to limit the structured programming as much as you can because you want natural relationships to form, right? Technology is a great example because, you know, we have a reverse mentorship opportunity there, you know. Younger kids that help grandparents, you know, myself gets helped by younger people and trying to help my dad. And, you know, it's nothing like trying to troubleshoot a printer when you're, you know, 500 miles away. So, but there's all those different pieces and parts of the technology that I think can bring people together. And looking at the community at large, finding those gaps. We don't want to warehouse people anymore. This is what's been happening. The original skilled nursing models and some of the assisted living models really were designed to basically mimic how we've done things in hospitals. They're not clinical settings. This is where people live, right? So there's opportunities to partner with universities. I've talked to one woman, she was writing an article. It was great to talk to her because she saw an opportunity on some of these college campuses as we're changing because of COVID-19, how we can actually evaluate using those universities around affinities. So it could be music, or it could be science, or it could be food culinary services. It could be almost anything as the affinity of what could draw a community together, right? So looking at community colleges, healthcare organizations, and resources to grow workforce development aspects of the community so that it is truly person-centered. So right now we're working on a demonstration project with using the residential assisted living and independent living. We have a potential site in East Jefferson in Detroit. We've been working with a developer out there who's been delightful. He keeps us moving too, because every about 8 weeks we have a call and we show the next stage of what pricing we've put together, or care model staffing. We worked on care model staffing on our last call. We've done some development around the building and what the building could look like, and if in an urban environment versus in a more rural or suburban kind of setting. Looking at soft and hard costs, and we're looking for potential funding sources. So as all those pieces and parts come together, our goal is, let's have a demonstration project as small as it possibly can be and work, and then we can look at replication and helping people to replicate the concept of live together. So Garden Spot Village has done a cooperative living, and it's basically 5 unrelated adults, but it's not assisted living. This is independent living for folks who may have, one woman, she had lost her apartment because they raised her rent by $100 a month, and that was just beyond her budget, beyond her means. So evaluating access, they did this more like a barn raising, which you can do in Lancaster, Pennsylvania, or maybe in Indiana, parts of Ohio. But they all came together to change the paradigm. So we see this in millennial living in terms of common.com. We see it in WeWork and We Live spaces. And so it's the same concept, but utilizing it for elders to make an affordable solution. So I want to show you this because these are existing apartments and then the apartments that were redone. But I want to talk a little bit about community involvement, but also about choice. So when we did the focus groups, we had this darling little lady. She had white curly hair and she was dressed in lilac. And she goes, I'd really like to at least have some choice in terms of what color got painted in my home. I was like, okay, so what color would it be? And she goes, well, of course, lilac, my dear. So we clearly knew right away. She was just darling. But what it was such a small piece of something that someone would ask. And typically a developer would be like, oh, that's too much work, too much coordination, blah, blah, blah. I got to tell you that after we did the renovation, the 2 things that were the most positive were the accessible bathrooms, because they were inaccessible before, and choosing the color within their apartment. Something so small that made them so happy. And so this was the bathroom situation that we had prior, and we gave them accessible bathrooms. And you can see that the curb, they used to make these showers a lot with the deeper step down. So then you not only have a step up, but a step down that's deeper than the step on the other side. It's a very common detail in older housing. And this is an independent living building, but different programming that was provided. And so this idea of supported services, this is Mr. and Mr. Figs. And what I will tell you is that the longer you live together, you really do start to look like each other. And I loved what they were able to do here because the executive director really gets it. She gets that the longer you can keep someone together, and if it's 6 months for an older adult, that's a long period of time. It's very essential to quality of life. And they were able to do this. So they had an assisted living program, and so they relocated their units where they were living closer to the staff. And then when the assisted living program went away, because she couldn't quite make it work, she was always like bringing different programs together, she realized that the senior center needed a kitchen, so she let them use their kitchen in exchange for providing a meal a day for every resident that lived there. And then they had a home health care provider come in and rent the space that used to be used by assisted living. So everyone got access to home health care. Everybody got access to physical therapy from an outpatient perspective. So there's ways to do this more affordably. And this is an affordable renovation that was a HUD refi project. So I want you to look at aging as a proactive adventure. This is on us, strategically, collaboratively, creating a new vision for all-inclusive environments. This is on all of us to make a difference and make it a change. And all of us need to be able to know that as we age, my friends will all say, so Jane, what are we gonna do? That's a lot of pressure. So, okay, what are we gonna do, right? We're gonna make a difference and we need to make a difference. So one of the things I wanna just point out to you is tomorrow, supposedly, hopefully still, the public comment period is going to open for the Facility Guidelines Institute books. So there's 3 books, and the Residential Healthcare and Support Facilities book is the Residential Guidelines and Licensing Code, and the public comment period starts. And if you would take a look, and particularly take a look at the assisted living section where we have redeveloped 3 different typologies that I think are very important for moving things to the future. So I'd like you to change the world, design as the power, go beyond, discover the possibilities, do great work, and care for those around you. I'm going to thank you, and I'm going to look at the questions box and see what we have and see what I can respond to. And my contact information is on this screen. What do we have in the Q&A? I'm sure a question that will be asked largely as it relates to the current pandemic is if you introduce a multi-generational community, that typically means more activity and in and out. How does that keep those at-risk members' health safer? That's a very good question. So we actually have redeveloped and redesigned. So our co-living, for example, so if you have 5 to 6 units that are sharing a co-living space with a kitchen and dining room and living space, we have talked about, okay, so if somebody, whether it is a staff member, or resident is not feeling well, we changed over the small bedroom bathrooms to also include a kitchenette, because if someone does have to isolate or quarantine, we can allow that to occur. So it's a lot of it is operational. So evaluating operationally how things can be done. In terms of multi-generation, like any community, if you, upon entry, want to do testing, you need a space for that with supplies and a place to do that, masks to be available, all the different things that you may need. So what we realized, though, is that this isn't that different in some ways from influenza outbreak when they closed down the nursing home or assisted living. Don't let anybody come in. A MRSA outbreak, E. coli. These things happen. I don't think the outside world knows that elder care communities and facilities can have these issues anyway. So in talking to providers, they're like, yes, we'd love to have a space, either, pre-vestibule, past the vestibule, however it may work, but it's basically a space that could be converted almost like triage when it needs to be there. So we are looking at things developed a little differently in terms of entry, how people are tested, not trying to isolate, right? We're really trying to evaluate, like a household unit, if you have 8 residents living together and you have consistent staff and the staff is basically tested regularly, you can pretty much keep that group of folks very healthy. We have found in talking with the Greenhouse Project, they're doing some research now that I'm hoping to be able to share in some writing that we're doing. And the wonderful part about that is they have had a couple of COVID cases, but they've had no deaths. And we're talking 262 facilities, right? So there really is ways of looking at it operationally, structurally, consistent staff, areas for things to look at. So it's like operationally programming the same way, but it's not going to keep our generations apart. It shouldn't keep our generations apart. Another one is, has there been any studies, projects using technology for senior living design, connecting seniors with families, live, daily, weekly? Yes, there's a lot going on in terms of technology and Zoom and all that kind of thing. You want to look up Lisa Cini, C-I-N-I, and she has some really good books on technology, and one called Beehive that would be very interesting for you. We also know that telemedicine's always been something we've been talking about forever in healthcare and senior living, but COVID-19 has made it reality. But now we're also realizing that people don't mind it, and people are doing really well with it. And it actually allows you to make appointments more quickly and make decisions more quickly and get care and get your prescriptions delivered. So as someone who's not feeling well, you don't even have to go out into the world if they can figure out what's going on. So I think that there's that part, and then there's a connectivity part, right? So, and my parents are a great example. They do not have a camera on their new computer. How did that happen? I didn't even know they made those. So we are trying to communicate, and they do very well on the telephone. And we have 2.5-hour calls every Sunday after we watch Sunday Morning and Face the Nation to have our political conversations. And then we also have Wednesday nights. And sometimes my Wednesday is a joke, because sometimes Jane's Wednesday night is a Tuesday, it's a Thursday, but somewhere in the middle of the week, we have a conversation. But I miss seeing them. I have not seen them since Christmas, and it breaks my heart. But we both know that this is safest for us right now, and we've talked about it. We've made those decisions to continue to do that in terms of actions. But I think that this opportunity for connectivity, my mother turned 80 in January, and she said, isolating those old people is going to kill them far faster than COVID-19. So there is a balance of, again, the risk part and how do you communicate and how do you bring people together. So I think that training staff to know better how to set it up. I've seen some really creative, great videos where they've actually put some videos together where they'll actually allow people to put them together, and then they bring everybody together, and then the staff has done amazing things, whether it's connectivity through Windows or connectivity through technology, but it has to be something that is almost a daily thing, particularly when people are isolated. But I don't think people were prepared for this in terms of how to do that. There was one facility in France that all the staff moved in. They left their families behind. One woman had a 10-month-old baby. She left them with other family members to take care of. She went into the facility with everybody else. They didn't have any deaths. They had no COVID-19 spread. They all stayed together. They all allowed people to interact and be able to interact. So maybe there's another way we can do that with technology, right? That allows people to still be able to be tested and be safe. So it's a balance. Anything you can do online absolutely is the right way to go. We have another question here. Let me scroll down. As a Black designer, I'm so excited about your research and your extended family. Yep, that's my family. How can designer bring social racial equity to our designs, being more inclusive and intentional? Are you aware of Detroit Homecoming Group? I don't know the Detroit Homecoming Group, but I've been working a little bit with Anya Rody at Taubman College. She's amazing. Does a really interesting interaction with students from all cultures to try to allow them not to be isolated during COVID-19. They actually created a computer program for drop-ins and things like that. Very cool. I've also, I've never been someone who's worked with color ever in mind from that perspective. It's always been neutral. You know, I've always had my girls, they call me Ma. They've been part of my family forever. I don't have any biological kids, so they really are part of my family. I have other friends that share friends and everything as well. And so let's have a conversation. You've got my email address, and this is from Darcille, I think is how I pronounce your name. Email me, let's talk about it, because I think all of this in terms of culture and understanding and equity and equality all needs to be brought to the forefront. And I think sometimes too, people are like, in terms of integration, like if I look at Cedar Lane, which is a more affordable community, that has people like, oh, it's affordable. Like as though people purposefully place themselves in a situation where they may not be wealthy. I don't think that that's ever the choice. And I think in this case, it's farmers and teachers and firemen and police officers and people who, people from all different backgrounds that have very good jobs and worked in healthcare perhaps, but don't have the opportunity for access to care or services. Food deserts are real, you know? the opportunity, I had this conversation about a community in Baltimore on Saturday or Sunday with a good friend of mine. She was down working on a community garden. It's in the community called Cherry Hill. It has a hospital there, but there's no grocery store. And when I worked in that community probably 15 years ago doing senior living work at their care, they have basically a senior center. We always had the food market, and we had it was a voucher program that worked really well in terms of fresh food and farmers market and that kind of stuff that always worked really well. But the community itself doesn't have the grocery store that it needs. And here we are these many years later, and it's still like that. And so she and I were talking about how to make some of those shifts and changes that need to be made. So I don't know if I completely answered your question, but here we go. Another question from the same person: are you using well and lead strategies when designing your new normal spaces? Well, a little tricky with lead and well because they're pricey and expensive. But I do believe in the principles of them. We're actually working on a technology right now that we just received a grant from CDC to work on to take the technology to the next level. But we like to use Fitwell because they actually have a monetary piece through Fannie Mae that if you do their certification, you get 15 points off your mortgage potentially. So we could actually do housing, multifamily housing that could be less expensive, plus they reimburse you for the rating system costs. So we look at that. I'm also a Green Globes assessor, and part of the reason I started doing that was my healthcare background, and I got to assess about 32 VA hospitals. But I like the hands-on approach of having the assessor, like Well does. Well has an assessor, but Green Globes has always had that. Their new existing building tool, I think, is going to be really valuable. So we've been trying to incorporate. Senior living has not been easy in terms of trying to incorporate that. We have another guide called the Senior Living Sustainability Guide. It's available on withseniorsinmind.org. There's also a good research paper on there by Robert Rublaski. It has great evidence-based design. So that's www.withseniorsinmind.org. Check it out. There's some good resources on there. The Senior Living Sustainable Guide needs to be updated, mostly the environmental part. The other parts are very valid in terms of operational review, resident care, resident needs, that kind of stuff. But we're actually looking for some volunteers to help us update that right now. Fantastic presentation. I shall call you. Okay, good. Call me. Designing in and not designing out. Yep, we like that very much. Let's see if we have anything else. We've got more under the share chat. Let's see what's under the chat. We can get that to come back up. There we go. And every time it pops up, it leaves again. Chat. Here we go. Nope. I love technology. How about you guys? Okay. There we go. Let's try that. Okay. I think that covers our questions, though. Let's see. I've got another question. Has there been any studies, projects using technology for senior living design? We talked that one. We did that one already. So must be scrolled down again. Here we go. From an interior design standpoint, what recommendations do you have to incorporate inclusion and more universal design? Know your dimensions. That's going to sound like a strange advice, but I have to tell you, ergonomically, I can't tell you how many people can't get up and down out of a seat or a chair or an arm because it doesn't have an arm height that's reasonable, right? So 20 seat depths in your chairs, a place for your feet to step behind the chair and the legs so that you can push up and out, things that make it easy to move and ambulate. The other thing I would say is lighting. And proper use of contrast. There's a lot of good documentation on proper use of contrast. Circadian system and lighting. Dr. Figueroa from Rensselaer Polytech, great resource, has really good, actually has some systems that you can actually use that are on her website that are really good. I would say that acoustics, because I think we're going to end up seeing more resilient flooring by default in terms of cleaning and disinfection than we are soft surface, just as a reaction to COVID-19. As a result of that, though, start looking at other ways to get some acoustic values. So we know that like ceilings in most houses are usually drywall. Well, with the drywall and a hard surface, it gets very loud and reverberation can happen. So if you can actually evaluate the ceilings and look for things that look like drywall that have some acoustic qualities, that's a good one. We use a rubber underlayment under floors. We just opened a new residential assisted living. We went to do the punch list last week, And we're very excited because it's actually quite quiet and it has a lot of drywall. But with the way the surfaces are and the way the flooring has been done, I think we're gonna have some good things to do. So think of universal design as inclusive environments that just allow as many people to be comfortable in that space as possible. And so if you're designing for elders from that perspective, you're really designing for everybody. So it can really help everybody. Any advice for designing for multicultural, multilingual communities? A little bit. So we have a cultural responsiveness section in the Facility Guidelines Institute books. And the reason we put that in there is because we want people, if you're working in Central and the Midwest, you pretty much have a homogeneous group. Both the staff and often the residents come from fairly similar backgrounds in terms of culture. However, when you we've worked in communities in Leesburg, Virginia, we've worked in communities down near DC, and it's like the little UN. There's every different kind of culture, every different kind of person around. So one of the things that we've looked at doing is in our focus groups is understanding what their backgrounds are, right? Because if you have somebody from Jamaica who's taking care of an Orthodox Jewish woman living in Miami, and she keeps kosher, explaining kosher to someone from Jamaica who might be Catholic it's tricky, right? So you want to first understand who they are, what they are, and what the backgrounds are, and then start to evaluate how you can put that together. So one thought I had around this, because I've been toying around with this idea a lot, is that what if you were able to bring people together and then allow them to share their meals, right? Share their recipes, because we talk about sharing recipes amongst the residents. Well, why not share their recipes amongst the staff and get people to try different things? And I think that whatever it is, food brings us all together, no matter what you look at. It's food, it's over the meal, it's breaking the bread. And I think that's probably what people miss the most in COVID-19 is the sharing of meals. So we've started doing outside meals in my little teeny garden. But bringing a couple people in so that we're still social distance, but we can share the food and the texture of things and the conversation around that. So that would be my advice for designing, is doing your programming planning phase of the design, understand who the communities are and what the communities are looking for. I wish I could see all your faces. COVID-19 has caused us to think differently about everything relating to care for seniors, details like hand sanitizing, delivering incoming mail and packages to an at-risk community. What are the most profound lessons you've learned from this recent worldwide crisis has changed how you approach your design solutions? That's a great question. That's a big question. One of the things that we have found, and we already knew this, so we have a group called the Durable Coated Fabrics Task Group, and it started almost 3 years ago now, a little over 3 years. And it was because we're having failures of product in healthcare settings. And so most of it was around the durable coated world, but we're having other issues too. It had to do with cleaning and disinfection, it had inappropriate material selection and specification for certain things. And I think that from the perspective of materials, I think looking at things that can be cleaned and disinfected, looking at that you don't have to use the bleach solution. You can use a quat. You can use, quaternary ammonium is a less harsh caustic, but still does its job in terms of cleaning and disinfection. Understand and learn more about cleaning and disinfection. I've written more COVID-19 papers than a human probably should in trying to assemble this for various manufacturing groups as well as design groups to try to understand better. So I think part of it is the processes, the thinking processes, and the operational programming part. But for me, the biggest, most profound lesson is isolation is awful. And so I think the profound lesson is that whatever we can do so that people don't have to be isolated. And I think a lot of this will have to do with testing. And if we could have ramped up testing faster, that would have been better. Hindsight, always 20/20. But in looking at it in the future, if we had a test, a rapid test, both for temperature as well as a rapid test for almost like a pregnancy test, but immediate, then you would be able to allow people to socialize. And I think the socialization and figuring out how to socialize, I don't know if some of you have seen the videos where people open their apartment doors and they're sitting in their apartments and they're having chats over happy hour. People need other people. I'm a more introverted person. I know it doesn't seem possible, but I am a more introverted person for the most part. I like the extroverted part, but then I retreat to being more introverted. Being able to allow people to still be with other people, I think is in the choice of that would be my most profound lesson, is finding ways in your design solution to evaluate how do you bring groups together. So if you have a bigger community and you need to bring smaller groups together, then how do you do that within your space? And how do you make that feel safe? And, you know, it doesn't necessarily have to be disposables. I think it's kind of funny that disposables have become part of it in terms of dining. And I'm like, well, you've done it with 160-degree water in that cleaning mechanism of the dishwasher. I trust that, you know, how you're handling yourselves. So I would say that the isolation, but also the heart, and how beautiful people are in terms of how much people care, and allowing that to be part of your design practice and the human interaction, and evaluating that, I think, is really important. And I think I'm over time, and I'm sorry because we have more questions. One asked, what color is my Harley? It's black. Anyway, I would like to turn it back over to Monica so she can close us out. I'm sorry we've run over a little bit with the questions. There was more questions, but if you get a chance, email me and I will try to respond to your question the best I can. Monica?
Jane, thank you so much. That was such a compelling and inspirational presentation. It was the perfect program to close out this NeoConnect series. We really appreciate you sharing your expertise with us today. I also want to thank Amelia Boo, our NeoCon marketing manager, who's been behind the scenes helping us deliver the webinar series. And I want to thank everyone for joining us today and throughout the month of June. Please stay NeoConnected with us by visiting neocon.com for more information on our library of resources and future programs and events. Have a great summer. Stay well. Thank you.